Okay, so we're going to take a look at now at the cranial meninges and the pertinent blood supply to the brain. Now, you may recall when we talked about the spinal cord, how, or I should say the entire central nervous system is enveloped in a connective tissue known as the meninges, going from outermost to innermost layer. You have the dura mater, which is very fibrous. Then you have the more delicate arachnoid, middle layer, and then you have the deepest, most delicate, the pia mater. You go outermost dura, arachnoid, then pia mater. Now, in the cranium, in the cranial cavity, you have dura mater that pretty much folds, creates some infoldings, and they develop partitionings within the cranial cavity, and they actually are located within some of the fissures that we talked about in our previous discussion of the cerebrum. So for example, you have the falx cerebri, and the falx cerebri is located normally within the longitudinal fissure. You recall what that fissure was? That's that long, deep groove that separates the brain into left and right hemispheres. So you have a falx cerebri, then you have the tentorium cerebelli. This is located within the, you recall that transverse fissure. Transverse fissure, that's the fissure that separates the cerebrum from the cerebellum. And then you have another dura, or partitioning, the so-called falx cerebelli, and this is, it separates the cerebellar hemispheres. Keep in mind the dura mater has two layers. It has what's known as the periosteal layer. This is the part that is in intimate contact with the bone tissue, or is what lines the inner part of the cranial cavity. And then you have the so-called meningeal layer of the dura, and that's the part that's in contact with the brain tissue. So your periosteal layer, meningeal layer. This meningeal layer is what folds in and is what makes up the falx cerebri, tentorium cerebelli, and the falx cerebelli. So here's a picture here showing you how these structures look in situ. So here's the falx cerebri, and again, notice how this is all dura, and it's nudged in nicely within that longitudinal fissure in between the cerebral hemispheres. Then you have the tentorium cerebelli right here, and you find that in between where you have your cerebrum and your cerebellum, which will normally sit right here. And then, so this is falx cerebri, then you have your tentorium cerebelli, which is this right here, and this part right here. And then finally you have your falx cerebelli, and this is the part of the dura that separates the cerebellar hemispheres. Keep in mind these this infolding of the dura is what keeps your, reinforces your brain within the cavity. So normally a person that sustains an injury, a blow to the side of the head, normally that damage will not really occur, a lot of damage will not occur, thankfully to the reinforcement of the dura in those parts of the brain. Now, as far as CSF, cerebral spinal fluid, you have areas within the brain, especially within the ventricles, areas known as the choroid plexus. What that is, basically, what's a choroid plexus is pretty much a combination of ependymal cells. You guys recall what those are? Those are specialized, epithelial cells, right, that line cavity or space. They line the central canal in the spinal cord. They also line the ventricles, And so you have a combination of epithelial cells in conjunction with some permeable capillaries. So if you look here, here's a blood vessel right here. And notice how here's a capillary. Notice how you have the endothelial lining of that capillary. And then what's abutting the capillary? You have these ependymal cells. You can see these ependymal cells have the microvilli at their apex. They also have cilia. So what's happening here is that we're creating what's known as the blood CSF barrier. Don't confuse this with the blood-brain barrier. This is the blood CSF barrier. So as blood is coursing through these capillaries, there's substances or plasma or what's known as ultrafiltrate is exiting or squeezing through the endothelial cells, squeezing in between these ependymal cells, and then they end up in the space in the lumen of the ventricles. So it's safe to say that CSF is simply an ultrafiltrate of blood. And as you can see here, there's these junctions here on either these cells are adjoined here, but they aren't very tight at the apex here. The idea is to allow for whatever's squeezing through here from the blood vessel, from the capillary, squeezing through the adjacent endothelial cells, and then it squeezes through these ependymal cells, or if not in between, through the actual cells, and ends up in the lumen. Therefore, that's the basis for cerebrospinal fluid. It is simply an ultrafiltrate of blood. Now, within the brain, you have ventricles or spaces or cavities, and here, this is how they are arranged. You have a pair, you have two lateral ventricles. Now, we're talking about in a normal brain. Sometimes, folks, there are some anomalies or birth defects in some infants, and you have a condition known as holoprosencephaly. And what happens here is that in this case, the infant does not develop a two lateral ventricles. Pretty much, they have only one ventricle. They do not divide into two like they're supposed to. Okay, and you have two lateral ventricles. Then you have the interventricular foramen. I should say foramen. There's two of them. They also call this the foramen of Monroe, if you're to eponyms. And then from here, the CSF. So you have CSF in the lateral ventricles. It goes to these foramina on either side. Then the CSF ends up in the third ventricle. You only have one of these, okay? And then from here, the CSF will trickle through what's known as a cerebral aqueduct, or they call it the aqueduct or aqueduct of Sylvius, or simply they call it the mesencephalic aqueduct. All these terms are used interchangeably to describe the cerebral aqueduct that drains CSF from the third ventricle towards the fourth ventricle. So again, to give you an idea, again, how CSF circulates within the brain, you have the CSF in the lateral ventricles. From there, it goes to the interventricular foramina, and then it ends up in the third ventricle here. That's in the vicinity, in the third ventricle, that's in the vicinity of the thalamus. I'll show you in a bit. And then from here, CSF trickles into the, it goes through a cerebral aqueduct that's within the midbrain, and then it goes down to the fourth ventricle. From the fourth ventricle, CSF exits through four openings. There's 4 openings. one opening, the median aperture. Median aperture. They also call this the foramen of Meninges. I'll show you a diagram that has already spelled out for you. And it has one median aperture. It can also exit through two lateral apertures and one median, two lateral apertures, and then it can also exit through the central canal. And we're talking about going from the central canal. As it exits through there, it goes through the spinal cord. So this is what we're talking about here. So here's your cerebrum. So deep within that, you'll find these spaces. So here are the two lateral ventricles here. You have two of them on the other side. So the CSF from here will course through and go into the interventricular foramen, empty into this area, this third ventricle. And then from here, it will drain, empty through the cerebral aqueduct that's within the midbrain, as I mentioned earlier. Then it goes into a fourth ventricle. And from the fourth ventricle, it can exit out through, as mentioned earlier, these lateral apertures here on the other side. There's one in the median. Now, the lateral apertures, or in the median aperture, I should say, it will go into this part, median aperture, which is towards the back. Let me go show you another picture here. Here we go. Foramen of Meninges. So as it exits out through the, here's the fourth ventricle here, as it empties out through that median aperture, the CSF will go into the space here. There is a space, a dilatation of the subarachnoid space here outside of the cerebellum. This is called your cisterna magna. Cisterna magna. Well, they also call that the cerebello-medullary cistern. It's just simply a dilatation of the subarachnoid space right after, right as the CSF exits or goes out through the median aperture of the fourth ventricle. And the lateral ones are going to carry the CSF over in this direction here, and then you also have another cistern over here. This is the interpeduncular. Let's just call it another cistern. Interpeduncular, or just cistern. Another cistern. This one's smaller. Just keep in mind that what these cisterns are, they are simply, a cistern is simply a dilatation of the subarachnoid space. Subarachnoid space outside of the cerebrum. Okay, so, and then also your another point of exit for CSF would be from the fourth ventricle through the central canal, and it courses through the spinal cord. Okay, not much to add to that. And then here's another view of the ventricles. Here's the lateral ventricles here. Again, CSF from here will go through the foramen of Monroe, or the interventricular foramina, into the third ventricle here. Then it will go down the cerebral aqueduct into the fourth ventricle. It can escape out through the lateral apertures, or the so-called foramen of Luschka, and can also exit out through the back, through the foramen of Meninges, or the median. So this is the lateral aperture, or the foramen of Luschka. These are the eponyms that the clinicians like to use. And here's the foramen of Meninges, or the median aperture. Point is, folks, these things have to be open to allow for the exiting or drainage of the CSF from the fourth ventricle to other parts. Now, sometimes, again, at birth, problems can occur in some individuals. If there is stenosis or lack of development of the cerebral aqueduct, remember that's the part that drains the CSF, that carries the CSF from the third ventricle to the fourth. If there's non-development of that or stenosis of it, then that can result in excess CSF in the subarachnoid space and the ventricles. It can increase the size of the ventricles, and then here's your end result known as hydrocephalus. And of course, this happens to the newborn also, because remember, the newborn has the fontanelles in the skull that allow for the expansion of the cranial cavity as such. Now, let's go into the blood supply of the brain. Now, before I start, keep in mind that blood enters or goes into the brain through blood vessel. There are two sources of blood entering the brain, I should say, and where you have, for sure, you have the internal carotid. That's one source of blood to the brain. And you also have blood from the vertebral arteries. Now let me show you a quick picture of that. Let me fast forward a little bit here. Here you go. Here's a picture that shows you the sources of blood flow into the brain. You have your internal carotid here and your vertebral artery. And notice how that blood vessel courses through the openings on the cervical vertebrae and the transverse foramina. Both vessels are going to enter and carry blood to the brain. So, now you have your carotids and their branches. So you have an external carotid artery. That's a blood vessel that comes off of the the branches of the heart. Great blood vessels. Now the external carotid, that blood vessel is going to supply blood to the neck, your pharynx, your esophagus, your larynx, mandible, and face. But for this discussion, my focus is mainly on the internal carotid artery, where you have a good amount of blood supply going to the brain. Now, the internal carotid does have branches. What we're talking about here in this part is the fourth part. The emphasis here on these branches is from the fourth part of the IC. Now, to review the internal carotid, as I mentioned, just to review very quickly, the internal carotid enters the carotid canal in the skull, and you have four parts to it. You have the cervical part of the internal carotid, part one. Second part is the petrous part. That's when it takes a quick bend, a quick turn. Then the third part is your cavernous part of the internal carotid. And this is the one that we're going to emphasize on the cerebral part. And some of the branches that come out that supply blood to different parts of the brain or that come off of that cerebral part include, for example, your ophthalmic artery that supplies your eyes. The anterior cerebral artery, that's another branch coming off of that fourth part of the internal carotid. That's going to supply blood to your frontal and parietal lobes. So let's quickly list some branches coming off of the cerebral part. So you have already ophthalmic, you have cerebral artery, another vessel that comes off of the fourth part of the internal carotid, another branch would be the posterior communicating. So here's one branch, ophthalmic, anterior cerebral, Another branch would be the posterior communicating artery. That's another branch coming off of the fourth part of that internal carotid. Another one would be the anterior choroidal artery. Right. And another one would be the we say posterior communicating, and then another one would be the, as we said, this is one, this is two, anterior cerebral. Third one, we already listed the anterior choroidal. And here, if you recall in my discussion on the cerebrum, the superior hypophyseal. Remember that blood vessel supplies the pituitary. So some of the branches of the internal carotid, way up there in the brain area. Then the internal carotid continues, and then it becomes the middle cerebral artery. And then this supplies blood to the midbrain and the lateral part of the cerebrum. So this is showing you a picture of not internal carotid, but a branch, an important branch of the external carotid. So here's, let me just draw it like this. This is the external carotid artery. Okay, and it gives rise to a blood vessel, the so-called maxillary artery, which is right here. My point is here is that you have a vessel that comes off of that maxillary artery called the middle meningeal artery that I addressed some time ago. Middle meningeal. Why this blood vessel is of clinical significance? Because as this blood vessel enters this foramen spinosum, which is right here, a little hole right there, it's going to come in here and is going to course along the inside part of your cranial cavity, like so. Here, there's the anterior branch, posterior branch of that middle meningeal. But notice how this blood vessel courses along this fragile area of the skull, the pterion. If there's a lesion of that blood vessel here, trauma to this side of the skull, anterolateral aspect of the skull, you can have a lesion of that blood vessel, blood's going to spill out, and then you end up with an epidural hematoma. Epidural, outside of the dura, so epidural hematoma. And to alleviate that, in the ER, what they do is they perform a procedure and they open up your skull. They do what's known as a burr hole. And the idea of that is to alleviate the pressure or to drain the blood in the epidural space or in the epidural area. Okay, so what else? And then you have the arterial supply to the brain. As I mentioned earlier, you have your vertebral arteries. Remember, these are the blood vessels that enter through the skull through they enter skull via that large opening in the skull, the foramen magnum. These blood vessels course through the transverse foramina, right, of your cervicals, C1 through C6. Okay, C1. In most of us, it goes through C1 through C6. Although C7 does have a transverse foramen, but the arteries mainly course through C1 through C6. in most individuals. Then you have another blood vessel here. You have what's called pica, ica. Pica stands for posterior, inferior, cerebellar artery. Ica stands for anterior, inferior, cerebellar artery. I'll show you what that is. And then you have another blood vessel called the labyrinthine, or also known as the internal acoustic artery. But this one has variations. This is important in terms of where this blood vessel branches off of. So, back to this image right here. Let me change encode here for a second. So, here are your vertebrals right here. Remember, these blood vessels. This blood vessel comes off of the enters the brain through the foramen magnum. This blood vessel courses through the transverse foramina in these cervicals. Then you have this blood vessel converging here into the midline. You have branches coming off of that vertebral artery. You have the posterior inferior cerebellar artery, or what's known as what we call pica. And then as you go up, you have another one, anterior inferior cerebellar artery coming off of the vertebral arteries, okay, or ica, okay, coming off of that. And then you have your labyrinthine artery right here. But notice how the labyrinthine artery in this scenario is coming directly off of, or branching directly off of the midline here, or this blood vessel here called the basilar artery. It's coming off of that directly. This only occurs in a small percent of us. Let me erase this here. Okay. The labyrinthine artery, it branches off of the basilar artery. I'll talk about in a bit. Basilar artery in a small percent of the population, in about, 15% of us. Okay? Because in most of us, in most cases, the labyrinthine artery branches off of the ica, anterior inferior cerebellar artery, in about, 85% of us, so to speak, of the population. So in most cases, that blood vessel comes off of the anterior inferior cerebellar artery, but in a small percent of us, it comes directly off of the basilar artery, as depicted in this image right here. Then you have the so-called basilar artery. To continue on here, your basilar artery, this blood vessel is in the median. Then you have pontines coming off of that. These are branches of the basilar. Then you have superior cerebellar artery, and then your posterior cerebral. I forgot to mention here, let me go back to this image here to show you the vertebral arteries. Notice how the vertebral arteries will give off a branch of a small blood vessel here that will converge anteriorly and run down the anterior aspect of the spinal cord. This is the anterior spinal artery. So the anterior spinal artery is formed from the merging of branches coming off of the vertebral artery right here, anterior spinal artery, anterior spinal artery. The reason why I bring this up is because if a person has a condition known as medial medullary syndrome, and when they have a lesion in that blood vessel right here, then that can cause problems. So medial medullary syndrome, the blood vessel that's going to affect is the anterior spinal artery. So going back to our blood supply, so here you go. Let's continue up here. So we already talked about the vertebral arteries, its branches, pica, what else? Pica, ica, right? And we also addressed the anterior spinal artery. Then as you continue upwards, we did address the labyrinthine artery. Then you have this So here, the basilar artery, right here. Then you have your pontines coming off of that, right, branching off of the basilar artery. Then you have your superior cerebellar artery, right? And then finally you have your posterior cerebral. So now we are moving closer to an area known as the circle of Willis. So now from the posterior cerebral arteries, then you have the posterior communicating, and you have the middle cerebral, anterior communicating, and your anterior cerebral. So let's take a quick look at what those are. So we've just coursed through the basilar artery, some of its branches here, the pontines, talked about that, the superior cerebellar, posterior cerebral. Now we're venturing now into the posterior communicating artery, your internal carotid, which continues and it becomes the middle cerebral artery, right? Then you have your anterior cerebral artery here. Then you have your anterior cerebral over here and here, and then you have your little bridge, your anterior communicating artery. Anterior communicating is right here. Anterior communicating. So you have your anterior cerebral right over here on either side, and anterior cerebral over in this direction. There is some clinical scenarios here, folks, with regards to these communicating arteries and aneurysms. So let me, before I mention that, let's talk about, again, let's take a quick overview of the blood flow. So again, this is to go back and show you the blood supply into the brain via the internal carotid, okay, carrying blood to the brain, and the vertebral artery carrying blood into the brain. And remember, this one in this case enters through the vertebral foramen. Remember, the internal carotid artery, it enters the skull through the carotid canal. The vertebral arteries enters through the foramen magnum. And then notice here, as it goes up, then the vertebrals converge and the median forms the basilar artery, and then it communicates with the internal carotid through this posterior communicating arteries. And as you can see here, it forms the so-called circle of Willis. Now, here, this is showing you pretty much, giving you a general idea. It's color-coded in terms of the parts of the cerebrum that are supplied by these major blood vessels. Like what is purple is supplied by the middle cerebral artery. Notice how it supplies a good amount of the cerebrum. You can see here the middle cerebral artery as it courses here laterally. It actually runs along that groove. Remember this groove here, the lateral sulcus, or let's call it they also call it the lateral or Sylvian sulcus. It's a groove here that separates it's a groove, right, let me change color here real quick. It's a groove that separates the temporal lobe here from the frontal lobe here, superiorly, this groove right here. You have this groove here, the lateral sulcus, or Sylvian sulcus, and where the middle cerebral artery courses through, and then it branches off. The blue part is supplied by the anterior cerebral artery, and what's beige is supplied by the posterior cerebral artery. If you do a sagittal view of the brain, of the cerebrum, you can see where the blue, this is indicative where the blood supply via the anterior cerebral artery, and then here is outlining the blood supply from the posterior cerebral artery, and then here this small little part by the temporal lobe smaller part from the inside that's supplied by the middle cerebral artery. So it's important to know, folks, try to, be aware that if you have lack of blood supply in certain parts, it can affect some basic functions. You recall that this part right here, we call this part here, name this part, remember this is what area? Focus area, and this is, remember, Meninges. Okay. So make sure that you know that you're aware of what parts are provided or supplied by certain blood vessels by the respective cerebral arteries and which branches, whether it's anterior, middle, or posterior. Now, then here, this is showing you the middle cerebral artery. And as it enters, as it courses along that groove, that sulcus, it gives up little branches. You can see it carries branches, these striate arteries, medial and lateral striate arteries. And these blood vessels pretty much supply the this one and this one. You can see where it's carrying the blood to, pretty much supplying the basal nuclei, supplying blood to the basal nuclei. So, if you recall from my previous discussion, this is the so-called lentiform nucleus, which has the globus pallidus and the putamen. And then here is the caudate nucleus right over here. So these parts deep in the cerebrum is supplied by branches of the middle cerebral artery. The medial and lateral striates supply those parts. And also you can see there is a white tissue separating, is also supplied by these blood vessels that separates the caudate nucleus from the lentiform nucleus. This is the internal capsule. It's mainly white tissue, and you have fibers crossing through there. But again, if there is lack of blood supply to these parts, that can cause major problems in an individual. And here is a killer, so to speak. This is what happens when you are aware of how blood vessels are configured. I did teach you that very early in the semester, how you have your tunics. Remember, blood vessels are an arrangement of a tube within a tube arrangement. And when you have a weakening of the innermost tunic, and then blood seeps into the middle layer, it weakens the wall, and this is the end result. This is what's known as an aneurysm. A bulging of the wall of a given blood vessel. And the problem with these scenarios or these problems, these aneurysms, is that a lot of them are asymptomatic. In this instance, notice how you have a bulging. It's rather small. To be more specific, this is known as a so-called Berry aneurysm. Here. Now, the reason why I bring that up is because when you're looking at let's go back to our circle of Willis here. You have frequencies of these Berry aneurysms in various parts of the intracranial circulation. So, for example, the most common and Berry aneurysm that occurs is at the so-called anterior, right over here in this area here, by the anterior communicating artery. So right about here, this is the most common type of Berry aneurysm. Most common. Second most common occurs by the posterior communicating. So the first most common is the anterior communicating. Second most common is the one by the posterior communicating artery here. Now, the posterior communicating artery runs in close proximity, this blood vessel runs in close proximity to the third cranial nerve number 3, which is your oculomotor. cranial nerve. So as I discussed in an earlier session, when you have compression of that third cranial nerve due to a very aneurysm in the posterior communicating artery, the end result is what's known as third nerve palsy, or what we call down and out. And you all recall what happens to the eye in that instance. That's because you have compression of that aneurysm on the third cranial nerve, the oculomotor nerve. And keep in mind, folks, I forgot to mention, you have blood supply, then you have drainage of blood from the brain. So this is showing you an overview of the drainage of blood from the brain. And here you have your superior cerebral veins here. Notice how these blood vessels drain blood, carry blood here into this large vessel called superior sagittal sinus. You might hear the term superior cerebral veins, or they also call these bridging veins. Now keep in mind that if you happen to have a lesion in any of these blood vessels, this usually occurs in scenarios of like the shaken baby syndrome. Ever heard of that? Shaken baby syndrome, when people do the most terrible things to younger children. Shaken baby syndrome. Or a person sustains a trauma or blow to the head, and it severs these blood vessels. What happens is, in the case of breakage or disruption of blood vessels, in these areas here, what it culminates in what is known as a subdural hematoma. So do not confuse this with the epidural hematoma. Subdural hematomas. Be aware that these hematomas, when they're subdural, they are pretty much considered slow bleeds. Remember, blood drains, so it's going to flow much slower in comparison to arterial supply. So this is a slow bleed, and usually these take several days for symptoms to appear when a person has a subdural hematoma. So a person can have a blow to the head, get up, shake it off, walk off like nothing, and then days later they collapse, because these are considered a slow bleed. So you have major drainage of blood from several sources. You have these bridging veins, you have this superior sagittal sinus, you have another one here, sigmoid sinus, transverse sinus. So let's take a look at how this is configured when you remove the cerebrum. Now, you have a superior sagittal sinus. This will, as you saw in the previous image here, will receive blood from the superior cerebral veins. Notice how you have blood from the superficial middle cerebral vein, receives blood from here, all these branches, and then you have this superior anastomotic vein that communicates or carries blood from the middle cerebral or middle superficial cerebral vein to the superior sagittal sinus, and then it ends up going this direction, like so. So you have superior sagittal sinus. You can see little branches of the bridging veins, right, entering into there, dumping blood into the superior sagittal sinus here. Then you have the transverse sinuses here. Now this part here, this so-called confluence of the sinuses, is located in close proximity to an area of the skull called the internal occipital protuberance. That's the clinical landmark that where you find this confluence of sinuses, or they also call they call this part the torcula. So blood drains in this direction. You have blood going this direction, ends up in this confluence, and then from here it goes like this, like so. Then deep within the brain, then also you have an inferior sagittal sinus here. And notice how these blood vessels are located within the falx, the superior and the inferior sagittal sinus are located within the folks. Remember, that's the meningeal layer of the dura. So you have this here, inferior sagittal sinus here, superior inferior sagittal sinus, and then you have the great cerebral vein receiving blood from the deep parts of the brain. You have sinuses all throughout here, like so. Blood drainage going back in this direction. Collects here in this torcula, or this confluence. It's like a major intersection where blood is collected. And then from here, blood will go out through the transverse sinuses into the sigmoids, and going out through the jugular foramen and emptying into the internal jugular vein. Another angle here showing you again, the confluence of sinuses here. Okay, this is receiving blood from the superior sagittal sinus. Then again, blood is in here, goes out through the transverse sinuses, sigmoid. Okay, here's a cavernous sinus right here. So again, you have more sinuses here, collecting blood, and all this moves in this direction, like so. And notice how this all eventually exits out through the jugular foramen. It's a very important foramen in the skull, the jugular. And then from here, blood will enter and drain into the internal jugular vein. Internal jugular vein. Important blood vessel where it receives most of your blood drainage from your head. So, keep in mind about the epidural hematomas, what causes that, and where the subdural hematomas occur. Keep in mind that the bridging veins are located in the subarachnoid space, while the middle meningeal artery is located outside of the dura, epidural. This is showing you, I think, the opening of the foramen spinosum, showing you the location of that middle meningeal artery. This is showing you what occurs in the subarachnoid space. You're all aware that the subarachnoid space circulates CSF. See it through here. But notice how you have these bulges, these little parts called arachnoid granulations or arachnoid villi. And these little structures, what they do, they act as outlets for the drainage of CSF. So not only does the superior sagittal sinus receive blood from the bridging veins and other blood vessels, it is also a site where you have CSF, wherever CSF circulating through the subarachnoid space. These little villi act as an outlet for any extra CSF, and it dumps into the superior sagittal sinus and rejoins circulation. And again, you can see here how you have your dura, and then you have the part as it divides, breaks up into the periosteal layer and the meningeal layer, forming these folks. As it breaks up and divides, it forms a sinus, a space to allow for the ending of blood vessels, of blood from these bridging veins, cerebral veins. And also notice how these sinuses are lined by a simple squamous epithelium known as the endothelial cells here. And here's the subarachnoid space, CSF. Notice how it goes to these little, bypasses all these trabeculae, and then goes in through here. CSF goes in through here, squeezes through these little cells of the arachnoid matter, and empties into the lumen of the sagittal sinus. There's a famous pediatrician. Speaking of politics, there is a famous pediatrician Retired pediatrician, neurosurgical pediatrician named Ben Carson, Dr. Ben Carson. He became world famous in '85 by being the first neurosurgeon to separate conjoint twins at the head. And he was the first person to do so, being the fact that these twins that were conjoined at the head, they were sharing the confluence of the sinuses. So his concern with regards to these infants dying from the procedure is from exsanguination. So he was able to, during the surgery, reconstruct a confluence of the sinuses for these newborns, and therefore allowing for complete separation of the newborns. Keep in mind, this was not only, aside from him, he had a large team of other surgeons to help out on the task of separating the successful separation of the conjoint twins at the head. And then here, folks, is a image showing you what a scalp is. People don't think about what scalp is. People think of a scalp as a skin on your head or whatnot. Scalp is actually an acronym that breaks down the head into regions. For example, S stands for skin. Okay, so you have skin first. C stands for connective tissue, right? A stands for aponeurosis. That's a flattened tendon that you find connecting the two muscles, one in the front, one in the back, your frontalis muscle and your occipitalis muscle, okay? Flattened tendon. L stands for loose CT, and P stands for periosteum. But in the case here, since we are talking about the scalp, it's pericranium. So going from superficial to deepest, you say skin, connective tissue, aponeurosis, loose connective tissue, pericranium. If you look here, you can see how you have the subarachnoid space. You have the bulging of the subarachnoid space into these superior sagittal sinus to allow for the outlet for some of the extra CSF. Keep in mind that people have to be careful with if they have a skin infection here, because you also have what are known as emissary veins. Emissary veins that carry blood from the skin. You have these perforations through the skull, and they also empty blood into the superior sagittal sinus. So the problem that can arise here is if you have an infection in the skin or whatnot, that infection can carry into your circulation. And then here you can see some of these bridging veins, some of the blood vessels in the subarachnoid space. So again, if you have a rupture of these blood vessels in there, they can cause a subdural hematoma or a slow bleed, which at times in some individuals can be asymptomatic. Okay, folks, that concludes my discussion.